Hello, everyone. Our chief guest, Dr. Sumro, is a little late for some reason, and so we will be starting the webinar, and I hope she can join us very soon. Um, Before that, we should start with introduction of the speakers, and I basically welcome you all to the IPRI's webinar on pandemics and evolution of international order. In the last 3 years, COVID-19 devastated the world, and COVID-19 pandemic led to concerns about rising inequality as it expressed the tilted engineering of the global economic system, which has in turn led to inequitable access to vaccines. Therefore, we have seen appeals for suspension or reform of various provisions of the legal apparatus. Moreover, changing dynamics of the world due to pandemics has led to reorientation in the interpretation of human rights, as well as redesigning of foreign and trade policies. To discuss these pertinent issues, we have three distinguished guests. Our chief guest, who will be joining us very soon, Dr. Shazia Sobia Aslam Sumro, is currently serving as the Parliamentary Secretary for the Ministry of National Health Services, Regulation and Coordination. She has been a member of the National Assembly of Pakistan from Sindh since August 2013. She has also been the member of various National Assembly standing committees. She belongs to the Pakistan People's Party. Our next panelist is Ms. Maha Rehman. Ms. Rehman has actively engaged in multi-pronged analytical responses to COVID in Pakistan, tracking the disease incidents and economic indicators, predicting disease outbreak. She has completed her graduate studies in economics from Duke University, United States of America, and has an undergraduate degree in economics and mathematics from LUMS in Pakistan. Our next panelist is Mr. Ataul Mustafa. Mr. Mustafa is a lawyer and has extensive experience in advising UN agencies, governments, national human rights institutions, and NGOs on implementation of international human rights law. He completed his graduate degree from the University of Warwick, United Kingdom, and has an undergraduate degree in law from International Islamic University, Islamabad. The opening remarks to our webinar shall be delivered by Director Research, IPRI, Brigadier Dr. Rashid Wali Janjua. Dr. Janjua is a graduate from Command and Staff College, Quetta, National Defense University, Islamabad, NUST, and Royal Military College, Kingston, Canada. He has served in various command and instructional assignments, including Pakistan Military Academy and Command and Staff College, Quetta. He has diversified civil engineering project management experience. Dr. Janjua, please give us the opening remarks.
Thank you, Shazid. A very warm welcome to all the distinguished speakers, especially Ms. Maha, who's awake in the early morning hours in the United States. So first of all, my commiserations for such an early call for you, but I'm sure we'll benefit by your insights on this very important topic. And Ambassador Dr. Raza Mohammed, Ambassador Durrani, and distinguished participants. Today's topic is something that is closer to the heart of all people who are seized with the global pandemics and their impact upon the health security of countries, especially in the global south. The mankind has seen the ravages of this pandemic, which swept across all oceans, and it was a stark reminder of the fact that nature still has the last laugh when it comes to dealing with health issues by humanity per se. Now, when we talk of pandemics, there is a clear binary between a pre-pandemic world and pre and post-COVID pandemic world. So it was a watershed event which completely altered the entire scenario of how global North and global South should coordinate their efforts to confront this scourge jointly and to alleviate the sufferings of humanity And it was a stark reminder of how the influenza epidemics in the past had wiped away the significant population of Europe, and especially in 1939, before the onset of World War II. United States was so enervated and so depleted that the war effort was stopped, and it acted as a bulwark against the war effort. And later on, once the several global cooperation regimes evolved, international organizations developed, and we know there are global cooperation agreements like Montreal, which stops and prohibits those substances which are harmful for the ozone layer. So similarly, what is harmful for the global health also needs to be formalized now. And the COVID pandemic was the starkest reminder for the need for that global cooperation. Now, international health regulations, we know, are binding on 196 member states of World Health Organization, which covenant was revised in 2005 following the SARS pandemics. So that was another pandemic that catalyzed the efforts to change that regime. Now, this should act as a catalyst to to create those core capacities in which the health systems and global North-South cooperation should be within the overall, context of United Nations purview maybe, and the WHO guidelines can play a very important role. And this was one of the objectives here to, have this webinar so that we learn from experts as to how those WHO guidelines can act as a beacon for further cooperation and create an international regime for pandemic, combating the pandemic at the global level. And now there are elements about human rights law, how it impacts the global cooperation when it comes to international order. International order is a very loaded term where there are geopolitical differences amongst the states. Sometimes those distances are and those differences both act as inhibitors to global cooperation, like we saw that something that emerged on the Chinese in China. So that impacted the whole world. The vector transmission and the disease transmission is so, the accurate and so fast nowadays that these diseases find presence on several continents, almost at the speed of travel. So this is again something that distances and the differences, the geopolitical angles, all have to be factored into how this international cooperative order has to evolve as against the geopolitical international order, which we know is all competition oriented and divisive. So with these few words, I set the stage for the first speaker, Maha Rehman, and then as we go along, the next speakers will speak and we lead the question and answer session so that the discussion brings out several aspects that we needed to mull over. So over to you, Shazib, for your invitation to Ms. Maha for her discourse.
Thank you, Dr. Janjua, for your insightful opening remarks. Our first panelist is Ms. Maha Rehman. I will request Ms. Maha Rehman to share her intellectual experiences and ideas on the current topic.
Thank you so much, Brigadier Rashid Saab. Honorable Raza Saab is also here, and thank you, Shazay, for the introduction. So I'm going to start off by also bringing in insights from how the pandemic affected Pakistan's relationship with the other countries, but also how did Pakistan deal with the crisis. and what do we need to do better going forward? So as we all understand that this was an unprecedented crisis in which a lot of our departments internally, as well as vis-a-vis international relations, we were thrown into a challenge that a lot of people did not know how to maneuver or what is the best way going forward. And so I'm going to divide my remarks into categories. First, I'm going to talk about the supplies that were necessary to deal with the pandemic. The second part, I'm going to talk about the systems that were necessary to deal with the pandemic. And then going forward, what are the steps that we need to take, given how the pandemic was different in Pakistan? So first of all, when in the onset of the pandemic, the most important question that began was that of testing kits and masking supplies. Our local capacity on various industrial units was not more than of producing 300 masks per day. That was not enough for a country of 22 million people. And so when going forward, in case of any such health challenges, when your local capacity is limited, then you're reliant on the relationship with other countries to quickly beef up those supplies. So to our advantage, we were able to procure those supplies from the countries that Pakistan had good relationships with. But even year 2 and year 3 into the pandemic, we struggled to fulfill the mask and the testing kit supplies. Second thing when it comes to supplies is your vaccine supply. Vaccine ke andar, the initial vaccines that flooded the market were the Chinese vaccines. And while there's a lot of debate on efficacy of the Chinese vaccines versus Pfizer and Moderna, but in the Pakistan context, they helped us save many million lives. In terms of Sinovac, Sinopharm, those were the first vaccines that came in. But very quickly, for this, we benefited from our relationship with China, as well as the relationship with US. And then Pfizer and Moderna also very quickly flooded the market. And so while it's the second year into the pandemic, into August, Pakistan had a choice of 8 vaccines to choose from. India, on the other hand, was not so fortunate, despite being a producer of the vaccine. So at that point in time, I was working in Punjab, but I was also working in Bihar. Bihar is a fairly rural province. And while Pakistan was struggling with the question of how to effectively reach out to the masses, Bihar was struggling with the question of supply kahan se laye, vaccine kahan se laye. We don't even have the number of vaccines that are required for a province like Bihar. So this is a fact that's not celebrated enough. कि जो Pakistan की government थी उस वक्त, they were able to quickly tap into our relationship with the countries that we were on good terms with and have your market flooded with vaccines that were required for the nation at that point in time. But when you have these supplies, then comes the question of that how do you effectively deliver these supplies and commodities to the masses? Now, that was a huge question because Pakistan mein aapke logistics and delivery systems and health systems are not as well developed. Just to give you an example, at the beginning of the pandemic, your policy makers in Islamabad could not tell you कि कौन से hospital में कितने beds खाली हैं. That's a very basic question. And so going forward, one very basic need that we need to fulfill for our country before we talk about international or international relations is to set up robust and agile health systems that quickly furnish data, that quickly allow you to get information, to act on that information. If you do not even know कि आपके पास bed कितने खाली हैं, disease incidence कितनी कहाँ है, तो you will not be able to effectively plan for an effective solution. The second thing, learn of the countries that have become pandemic resilient. There have been variant flus that that the world has seen right before the pandemic as well. And there were certain economies like that of Singapore and other economies that developed very quick, agile, and robust data systems that allowed it to deliver effectively, collect data effectively, and develop indigenous solutions. एक और चीज जो हम appreciate नहीं करते, which was very different about the pandemic in Pakistan, is that The pandemic in Pakistan was mostly an urban phenomenon. It did not wreak havoc in the rural areas like it wreaked havoc in the rural areas in India and Bangladesh. India had to develop a lot of rural solutions as well, but in Pakistan, for reasons that researchers and policymakers do not understand as yet, the virus did not go into the rural areas, despite the fact that there was movement in and out of rural areas. Despite the fact that using the telco data, you could tell that the migration to and from villages had not stopped, but this did not become a rural phenomenon. So because the pandemic was of a different nature when it came to Pakistan, then you need to develop indigenous solutions. You need to have local data systems. You need to have local research so that you can quickly act upon that research. Alongside, जब आप data systems की बात करते हैं और आप health systems की बात करते हैं, then there comes the question of measurement. How do you measure the various aspects? How do you measure disease surveillance? How do you collect data to effectively diagnose what the constraints are and then effectively treat them? Then in Punjab and KP and even the federal government used fairly innovative measurement techniques. Mask measurement ke liye, while in Lahore, when I was doing the research, we deployed enumerators all over the city that were measuring mask wearing several times a day. And then we were collecting the data in real time, collating it in real time, and then transporting it back to the district authorities. Federal government at the same time was monitoring mask wearing rates through the CCTV cameras and then using machine learning and the AI technology to measure what the mask wearing rate was. The second thing that we did in Punjab was testing the sewage waters using the methods that we have developed in polio for disease incidence. कि जहाँ पे आपके tests, so what are the areas that were still active as far as the COVID incidents were concerned. And then since this was mostly an urban phenomenon in Pakistan, तो जो आपके delivery methods आपने mostly rural areas के लिए develop किए हैं, वो urban areas में काम नहीं करते. Rural areas में you can tap into the communal leader, you can quickly disseminate information. Disseminating that information in big urban centers like Lahore, Karachi, and Islamabad is not the same. So how do you effectively understand the information networks in these urban areas for quick delivery vis-a-vis health messages? And that will also become important for delivering key messages now for the environmental challenges that you're facing. And lastly, the thing that I would want to quickly touch upon and leave the conversation with is that it's very important to embed technology in any response, in any health response. Whether that's concerning measurement, whether that's concerning delivery, and whether that's concerning building the robust data systems going forward. KP had developed a very good database. Punjab struggled as far as data management was concerned. In Sindh, that was non-existent. So there was a lot of disparity between the provinces when it came to measurement and delivery. And lastly, another fact that's not celebrated enough is that the federal government, NCOC, that was chaired by the federal policymakers, as well as your personnel from the army, they were extremely effective in delivering a good and a swift response where it is needed. So our logistics and our delivery was really spot on. Now, this is another aspect that our neighboring countries like India, etc., struggle with. Because once you have the policy in place, once you have the data in place, then you need to quickly move resources from point A to point B, and that is something your armed forces are very adept at doing, are very adept at advising, and they have fairly good infrastructure to do that. And so that was extremely robust and strong for Pakistan, and something that can also serve an example for other countries in the region. So while there are a lot of things we need to do better going forward, there are also a lot of things that we did do really well, and we need to celebrate that. So I'm going to leave it at that, and I'll be happy to contribute as a discussion goes forward.
Thank you, Dr. Maha, for sharing your thoughts. I think the intersection of analytics and understanding ways to curb pandemics is incredibly interesting. We acknowledge the presence of our chief guest, Dr. Shazia Sulbia Aslam Sumro. Dr. Sumro, can you hear me?
She's muted. I think you need to call her.
I think I have. Dr. Sumro, can you hear me?
Yes, I can.
Okay.
There's some network issue, I think.
All right. We might wait for you till the end. I think till then you can, you can solve your network issues, and we can go for the next panelist. So our next panelist is Mr. Ataul Mustafa. And Mr. Ataul Mustafa, please share your legal insights on this very interesting and important topic.
Thank you very much, Shazia, and thank you very much, Brigadier Rashid Saab and His Excellency Ambassador Raza Mohammed Saab for inviting me to this important webinar. COVID-19 has impacted every aspect of life, and it also has impacted international law and particularly international human rights law. And my remarks will be around the impact of COVID-19 emergency on implementation of international human rights law and the way forward. So first of all, the adaptability of international laws. I just want to make a quick reference to some of the provisions of International Covenant on Civil and Political Rights, as well as International Covenant on Economic, Social, and Cultural Rights. Pakistan is also a party to these important international covenants. So these covenant talks about emergencies and recognizing them as one of the situation where implementation and of human rights may be restricted. Derogations are possible according to Article 4 of ICCPR, and then limitations are also possible with regard to certain human rights provisions. One thing I just want to make, I just want to explain that international human rights law believes that economic, social, and cultural rights are as important as civil and political rights. But in practice, civil and political rights are given more weightage than economic, social, and cultural rights. But due to this pandemic, right to health is one of the area which actually restricted some of the civil and political rights. Freedom of movement was restricted, freedom of peaceful assembly was restricted as a response to COVID-19 emergency, which actually shows that economic, social, and cultural rights are equally important as compared to civil and political rights. And countries should also focus on their healthcare system, their education, and all other economic and social aspects of life in order to be resilient. इंटरनेशनल लॉ जैसा कि मैं गुजारिश कर चुका हूँ recognize करता है इन emergencies को. However, the yardsticks, the fundamentals, and the provisions related to emergencies were not sufficient. यही एक रीजन है कि आजकल WHO is negotiating a draft treaty on pandemic. And that draft is also available on WHO website, and 194 states were agreed to have a separate treaty to deal on this, which actually shows the current provisions and flexibility of international law is not enough, and we need to have a specialized treaty and specialized response for that. Some of the challenges which international order has faced and the international community has faced due to pandemic is one of the phenomena known as equity pricing. Vaccines were developed by some of the companies, and then it was get patent under different IP laws, and which has restricted the access of these vaccines to underdeveloped countries. So in order to deal with the monopoly, some of the measures were taken by WHO. One of them was equity pricing. A reference pricing was introduced, and And through this mechanism, underdeveloped countries can purchase these vaccine on reference point through COVAX facility. So similarly, WHO has waived the compulsory licensing requirement for non-exclusive use of this vaccine. Unfortunately, some of the countries which would take benefit of that could not take, including Pakistan, due to lack of the technology and infrastructure. The third challenge which international community face and address with regard to accessibility of vaccine is that the TRIPS framework and the TRIPS framework and the different regulatory regime. This actually led to the negotiation that international law should have a dedicated treaty to regulate these matters and to have some kind of flexible environment and requirement for the equity and equitable access of these vaccines to underdeveloped countries. Right to health is one of the key major area in this whole pandemic, and international law now has some expert believe that this right has been redefined by the pandemic. And previously, the restrictions and exceptions which were adopted by international community under international law were considered to be a negative measures, but through this pandemic, these restrictions on human rights actually played an important role to contain this virus, whether it be a quarantine or freedom of movement or freedom on travel. All these restrictions has played an important role in response to this COVID emergency. So the definition of right to life and right to health has been changed and impacted a lot by this COVID emergency. So Pakistan, as the international law believes that there are gaps in the current mechanism and there should be a separate dedicated treaty. Pakistani laws are also deficient in terms of equitable prices, equity prices, and accessibility. We used 1958 Epidemic Diseases Control Act to cater our needs. However, this law is also quite old and it also need to reform. National Command Operation Center is one of the measures which were taken by the government of Pakistan is praised by internationally. This kind of policies by us should also be embedded in law so that if in future emergencies, these are the main actors in addressing and prevention and response. So one last thing which I just want to highlight that despite there are clear provisions with regard to derogations and with regard to limitations, but even developed countries, some of the European countries are also mistreated some of the elements of human rights law, which actually shows that this mechanism for implementation of human rights in time of emergencies and epidemics needs to be reformed and strengthened. I'll give you some examples which were highlighted by international media as well. The separation of children in immigration detention center in USA was one of the area. Even last week, one of the reports say that still there are children which are waiting for unification with their children. So again, immigration and immigration detention facilities, then facilities in jails are usually limited, and it's impossible to have social distancing in jails and detention centers. So these kind of vulnerable population needs to be factored into the new legislation. The treaty, COVID draft treaty has factored in all these situations, and provided guidance. But unfortunately, as I consider, there is a lack of implementation mechanism in that treaty and lack of enforcement mechanism. Companies are monopolizing and using content, patent, and IP laws to restrict the accessibility. And then again, higher prices is also one of the issues. So international law and specifically these draft treaties needs to be strengthened in terms of implementation and enforcement mechanism. As a last remark, international law is one of the area which is also impacted by the COVID emergencies and derogations, which used to be considered as a negative derogations. They help nations to survive, and but again there are gaps and which shows that international law needs to be reformed and rebuilt. Thank you very much. Over to you, Shazia.
Thank you, Mr. Atal Mustafa, for your very erudite insights into the law and the intersection of international economic rights and international political rights. I think that was really, really interesting. Dr. Sumro, are you present in the meeting? I think Dr. Sumro, can you, you're present in the meeting, can you respond?
Assalamu alaikum. Can you hear me?
Yeah, we can hear you. But your
Okay.
video is probably off. If you want to speak like this, it's fine too.
I think there is some network issue here.
All right. So if your internet connectivity suits audio call, I think that would be fine too.
Okay.
Yeah. So please, you are the chief guest for this webinar. So we thank you for your presence, and please share your insights from the government perspective on this very pertinent topic.
I think Shazib, thank you. First of all, thank you for inviting me on this important public health related issue. I think Pakistan has faced significant challenges in responding to COVID-19 pandemic, particularly in areas of care, economic stability, and social protection. The availability of vaccine has been influenced by Pakistan's foreign relations with vaccine producing countries. The government has engaged in diplomatic efforts to secure vaccines and other medical supplies and will continue to work closely to the international partners to ensure their availability.
Dr. Sumro, we have lost you. I think we cannot hear you anymore. Your internet connection, can you hear me?
Please wait for a few moments.
Okay.
Hello, you're there?
Yes, we can hear you.
Yes, we can hear you, Dr. Sumro. Please continue. Yeah.
Okay. I think main problem is data collection. Main problem we are facing is data collection. Because मैं समझती हूँ कि हमारे जो अर्बन एरियाज में जितनी अवेयरनेस थी या जिस तरह से अवेयरनेस कन्वे की गई थी थ्रू गवर्नमेंट और एनसीओसी एंड अदर रिसोर्सेज, वो तो मेरे ख्याल में बहुत लोगों ने इस चीज को फॉलो किया, बट इन रूरल एरियाज वी कांट रीच देयर, क्योंकि वहां पे एक अवेयरनेस क्रिएट करना, लोगों को समझाना सबसे ज्यादा मुश्किल था. I think the government has supported efforts to strengthen the legal frameworks for pandemic response, including compliance with the international health regulations. And we will continue to work with our international partners to ensure that the global response to future pandemic is grounded in strong legal and institutional framework. तो मुझे लगता है कि we need to develop legal policy and political frameworks that can help us respond more effectively to future health emergencies. And the government is committed to investing in healthcare infrastructure, promoting research and development, and enhancing our emergency response capabilities to better prepare for the future pandemic. मेरे ख्याल में इसके लिए हम सबको मिलके एक पेज पे होना पड़ेगा, क्योंकि there is no role of only policy makers. The main issue is implementation. जब तक हम कोई पॉलिसी बना के, कोई लॉ बना के, कोई रूल बना के उसको इम्प्लीमेंट नहीं कराते हैं, we are facing these type of issues repeatedly. तो मेरे ख्याल में हम लोगों को इन चीजों पे बैठ के बात करनी चाहिए. हम सबको being a policy maker, being a health professionals, being a law maker, हम सबको बैठ के एक पेज पे होना होगा. And the government is supporting you every time. जो भी आवाम के लिए मेरे ख्याल में बहुत अच्छा काम करे, हम सब उसके साथ बैठ के काम करने के लिए तैयार हैं. Thank you so much.
Thank you, Dr. Sumro, for your remarks. And I totally agree that the consensus is the key for any kind of inclusive policy. I will open the floor to questions. If you have any questions, please raise your hand and unmute yourself, or you can also write it on the chat box.
Shazib, can you hear me? This is Mehvish.
Yes, Mavish, please ask your question.
So I really want to ask a lot of questions. So one of my questions is from Professor Ataul Mustafa. That time and again, we have heard and talked about the surveillance of states upon citizens. So how has it changed the discourse of human rights in like post-pandemic period or during pandemic as well? So the other questions where panelists can also like contribute towards it came how Pakistan has prepared itself after post-pandemic period, considering that Pakistan has significant socio-economic disparity in the state. So if you guys can contribute over it.
Mr. Atal Mustafa, can you answer the question?
Yeah, thank you very much, Shazib, and thank you very much, Mavish, for the question. Right to privacy is one of the central fundamental rights, and it was considered by some of the rights groups that surveillance by the state in order to respond to this COVID emergencies was violative of international human rights law. However, if we look at the general comment of the United Nations Committee, several communications were submitted in this regard, and I can refer to two United Nations. One is related to USA regarding infringement of rights on surveillance and all this. The committee actually referred to this Syracuse principle and the necessity to have derogation in terms to save the life of the nation. And they actually referred to the test, I think the litmus test, which is a guiding principle for this kind of surveillance as well, that if these measures are emergency measures and necessary to handle these kind of emergency, then it should pass at least three yardsticks. Number one is these measures are necessary, and second one is these are proportional. The third one is these are grounded in the law. So several countries reported that this is COVID-19 is an emergency of a type where surveillance can play an important role in tracking the cases and responding to these emergencies. They have justified their bias on the according to these Saracusa principles and the different elements which is being referred and mentioned by the committee. So yes, again, just to conclude that if these measures are targeting and helping and assisting the state to protect the life of nation, and these are limited and time bound and reviewed and necessary and grounded in the law, then international law permits that. The only thing is that it should not be targeted discriminatory. Thank you very much, and over to you, Sajid.
Thank you, Mr. Atal Mustafa. Ms. Mahariman, do you want to add on something, or you want to share your thoughts on this?
Yeah, so on the second part of the question, that the socioeconomic disparities, so the socioeconomic disparities were only aggravated by the pandemic. The two classes that were worst hit were the middle class and the lower income class. So while there were subsidies that were targeting the lower income class, the lower middle class was really left stranded as a result of the income loss in this pandemic. They were not covered by any social protection program, and they were in a place where they find it inappropriate to go and ask for help. And so there were no measures in place to help and to facilitate the lower middle class. And so even 2 or 3 years after the pandemic, if you look at the income statistics and you look at the employment statistics, while employment has picked up, your income for these classes has not picked up. It hasn't gone back to the pre-pandemic levels. And while the only income that was somewhat stable during the pandemic was the farm income, the non-farm income in the rural areas, as well as the lower income and the lower middle income in the urban areas were very badly hit. And so going forward, while the lower income classes are covered by social protection programs, which was very well targeted, and that was another achievement of the Pakistani government in the pandemic. But we also need to actually analyze the impact and have rescue and aid packages for other income groups that are targeted, that were affected during the pandemic. Just giving some comments on Dr. Sumru's remarks. And so she spoke about data collection. So another big achievement post-pandemic is that whatever we have learned in NCOC in terms of how to gather data, how to use data, and how to implement it, that expertise has now been institutionalized at NIH as a National Institute of Health. So going forward, I think that's exactly how it should be, that any body that's set up to deal on an emergency basis with a crisis like pandemic, that learning and that knowledge needs to then be institutionalized and built upon going forward. And having said that, another challenge during the pandemic was that the data that was being collected was very closely guarded. That becomes counterproductive, because if you open that data up to people who can effectively use it and help the policy making, that only helps the case. And so then opening up the data allows you to crowdsource solutions and to crowdsource diagnostics. So going forward, that's another area we need to be looking into, that while guarding the privacy concerns, how can you open up the data for people to aid the decision-making in the country?
Thank you, Ms. Maha. I think I totally agree that, if you're closer to the state of nature, generally any kind of calamity hits more, as the lower income group is generally very close to nature. So we are open to further questions. Please raise your hand and speak out if you have any questions, and you can also write on the chat box. All right. I think one of the questions.
Shazib, can you hear me?
Yeah, I can.
So I have a question because the topic of today's webinar was international order and the cooperative arrangement. So my question is to Ms. Maha. What is the possibility of an international treaty on pandemic cooperation?
I think international cooperation is going to be very much needed going forward. But whenever you're talking about a treaty or a collaboration, you also need to be simultaneously thinking about the implementation capacity. And so going into and planning and drafting a treaty like that, you need to be aware of the limitations of an implementing body like the WHO, the World Health Organization. So the World Health Organization also took its own sweet time in updating its own guidelines, even though there was ample evidence available in terms of the efficacy of masks, what's the most effective vaccine distribution mechanism that's there, but its effectiveness in terms of implementation of what we consider the some standard norms was very limited. On the other hand, what really worked at an international forum were mechanisms like advanced vaccine commitments. So it was the advanced vaccine commitments and the funding that went into it that allowed quick vaccine development and then quick vaccine dissemination. So when we talk about international collaboration, we need to be mindful of who are the right players that can effectively negotiate that can effectively bring the world together in a calamity like that. And is treaty the best way forward, or do we need more mechanisms like the advanced vaccine commitment while we're going forward?
Perfect. Dr. Sir Asif Durrani, sir, do you want to say something?
Yes, I have a small question, very enlightening discourse indeed. Any of the panelists can answer that of late we heard about the problem with Pfizer, about the vaccines. So where do we stand now? The question is, what is the advice for the world? And if those who have in fact been injected with Pfizer vaccines, what will happen to them in case they develop complications? Thank you.
Ms. Maha, do you want to answer this question?
I think in terms of the side effects of vaccines and their efficacy, there was a lot that was also being said about AstraZeneca. So I think we will see what the side effects are as the research evolves. But so far, in terms of efficacy and safety, still Pfizer and Moderna are the two vaccines that top the chart. Going down the vaccine list, you also have the Chinese vaccines, which were the efficacy is much less, but they were considered a safer option. So in terms of what will be the side effects, I think we still need more research on that. And there are medical groups that are working on answering these questions.
Thank you, Ms. Maha, for your answer. We have one question in the chat box from Zishan Hussain. He asked that how Pakistan used the COVAX platform to obtain vaccines, a mechanism under WHO, and what price did Pakistan pay in terms of dollars. So I think what he was asking us that under what legal mechanism Pakistan procured these vaccines, and we paid a lot of price in terms of dollar. And since we are already dollar starved, how this pandemic treaty can be viewed under the third world approach to international law. Mr. Atawul Mustafa, would you like to answer this question? I think it's more from the legal side of it. Do you understand the question? I can.
Yeah, thank you very much, Azib. Well, it was actually an arrangement between different companies and facilitated by World Health Organization and different UN agencies, and that calls Open Pledge. And under that umbrella, different companies came together and they innovated the vaccine, and then then was able to give access to different countries and the people of Pakistan. So this was one of the innovative idea which actually used by the Gavi and the COVAX alliances under the umbrella of WHO. And this is one of the mechanism which is also being proposed in the draft treaty as well. So one of the area which international law should also look into this, because again, underdeveloped countries and as you are talking about the most vulnerable population of underdeveloped countries, they do not have capacity to buy these expensive life-saving vaccines. So the model which was used in the pandemic was the government sponsored some of the researches in the private companies and educational institute. They innovated and developed that vaccines under the umbrella of the public funding, and then through COVAX facilities, it was routed to different countries, whether it's a third world country or developed countries. But again, certain challenges which during this pandemic, the international community considered that equity and accessibility was some of those challenges which international law should look into this. And that's why a major part of the draft treaty of WHO, which is also available on their website as well. It was published last week, I think. It was that most of the part was dedicated on the generation and patent and accessibility and distribution of these important vaccines through COVAX. So I hope I have answered this question. The second part of the question is how many dollars? Honestly, I do not have this information available with me, and most probably I think it's a $12, if I'm not mistaken. But we have to check on this. If somebody can help, I will appreciate that. Thank you very much, and over to you.
Yeah, that's very interesting. I think as a very interesting analysis, intersection of trail and pandemics, how we procured, the vaccines. One question is, again, this is again directed to Mr. Atal Mustafa, and it's from Ms. Mehvish, that she asked that if we use surveillance for the protection of citizens of state and then collect data, wouldn't it be the contradiction with Article 14.1 of the Constitution of Pakistan, that is right to privacy of citizens? Mr. Atta, would you like to answer this question?
Yeah, sure. Thank you very much, Mavish. I don't see any contradiction with regard to Section 14.1 of the Constitution of Pakistan and this privacy measures. Actually, as I mentioned earlier, these were measures taken in emergency, and in such kind of emergencies, international law permits derogations and limitations on certain rights. And similarly, this surveillance, which was used for public good, as I said earlier, this surveillance was used to collect data, to respond, reform the policies, and to protect the life of so many people. So I don't think things that if extraordinary measure which is used to strengthen other human rights, particularly right to life and even life of the nation, that is being violative of international human rights law. International human rights law has given international standards that needs to be complied, and some of them, some of the important standards, which is even highlighted by the Human Rights Committee in several documents, that these measures should be limited in duration. It should be necessary. These should be proportional to the object, and these are important measures. And if these yardsticks are fulfilled, then I think international law tolerates these derogations and allows states to take extraordinary measures, including surveillance. Thank you very much.
Definitely. I think the proportionality standard in derogation is the key here. Thank you, Professor Mustafa, for your erudite answer. We have a question from Ms. Maham. We saw that, she asked that, we saw that vaccines approval mechanism was greatly impacted by the power competition between the nations. We saw how some vaccines were travel friendly, but others, like the Chinese one, were not. What do you think about that? Ms. Maha, do you want to answer this question? Because I still remember I was not allowed to travel because I had a Chinese vaccine. So,
Yeah, so I'll just quickly also comment on the last question. So, I mean, there's always this debate between how can you effectively use data without infringing on the privacy of citizens. And uske andar then there are various ways in which different states have drawn up data acts. And one way to go forward using that data is to use de-identified data that doesn't link the data back to the individual using identifiers like the national ID, their location, their address. So that is an effective way of using that data without making public their private details. Again, and then coming to the question that is there that Maham asked. So while now the Chinese vaccines have been included in the travels, have been approved for travel in a lot of countries, but one vaccine that still has not seen the approval is Sputnik. So who was carrying out a process of approval of this vaccine. But even that process of approving this for international travel has been abandoned after the Ukraine war. And so I remember that was the only vaccine that was privately available in the beginning of the pandemic. And there were several people who only went for the Russian vaccine. So while the US and other countries and even European countries now approve the Chinese vaccines, as well as Pfizer and Moderna and AstraZeneca for international travel, the Russian vaccine has still not been approved for travel, and that has impacted people's decisions and to study work in other parts of the world and who have been vaccinated using this vaccine. And so I think while you're playing geopolitics in a matter that's purely health related, you're playing politics on that. You need to keep these health considerations and these health processes separate from other political considerations. And so that's one thing where who should step in and legislate for the future pandemics and future health emergencies.
Thank you, Ms. Maha. There was one more question. It was directed to Ms. Dr. Sumro, but she is not here because of her internet issues. But maybe Mr. Atal Mustafa can answer it. The question was basically how local governments can be used and how effective they are, how effective they can be in terms of combating pandemics. It's somehow related to a little politics law perspective. So Professor Mustafa maybe can respond to that.
Well, Shazib, I can try, but local governments are an important pillar of the executive, and the response and even preventive measures in COVID-19, they were also addressed to local governments actors, whether it be a district health officer and health facilities administering the COVID vaccines, or whether it's district government pillars and local bodies is sensitizing their communities for the social distance in all this. So local governments are important, rather I can say very important in response to the to any emergency like COVID, and then again, this is one of the pillars through which provincial, federal, or even state broadly respond at a grassroots level. So by strengthening local governments, then again specifically we have seen in this emergency that there was a great pressure on health facilities at a local level. That actually requires that this facility, the health facilities at local level needs to be strengthened. Then again, the public health facilities at the local government level, the awareness and coordination mechanisms with the local government and provincial government, and then at the federal level. These are some of the areas which we should look into this and strengthen so that we can address and respond to future emergencies in an effective way. I hope I answer you the question. Thank you very much.
Yes, thank you, Professor Mustafa. Ms. Maha, do you want to say anything about this?
I think that has been covered.
Do you want to say anything on this? Yes.
No, I think that has been answered well.
Perfect,
And
perfect,
commented
perfect.
that.
Perfect. We are open to other questions. If anybody has any question, please speak out, or you can also write it on the chat box. Mr. Numan, do you have raised your hand? Please speak. Mr. Numan?
Yes. This is Manbacha. First, I thank and appreciate the management that they organize such fruitful webinars. And coming to a question that, am I audible?
Yeah, you are audible. You are audible. Please speak.
Okay. Let me ask the question. We can say that the pandemic has, the COVID-19 has turned the world upside down, and even it has altered, in a sense, international order. Initially, as the pandemic broke out, countries, nation states were led to fend for themselves. But in the mass COVAX facility was introduced. So my question from Mr. Atta Mustafa is that, which is relevant to international law, that the COVAX facility was supposed to deliver equitable access to COVID-19 vaccines, but later it proved, and there were reports in international media and all that, that the COVAX facility was a broken promise because it did not ensure the equitable access of COVID-19 vaccines to countries. So my question is, how can international law ensure equitable access in shape of any such facility in the future? Sir Atta, did you get my question?
Yeah, I got your question.
Thank
you very much, sir, for asking this interesting question. Actually, this is one of the gaps in the COVAX facilities, and the promises made by international communities were not honored, and there's no doubt in it. There are several studies available. And if we look at the statistic of Pakistan, I think one can say safely that COVAX has contributed a lot, but if we compare our needs and assessments, then a lot more need to be done in terms of accessibility and availability of the vaccine. This is one of the reasons that WHO has actually proposed this new framework type of convention. It's not a simple treaty, which we normally have in international law. It's actually a framework treaty, which actually provides a framework, and then they have counter into the factors of the contribution of the states to different states to international community. Then they also calculated different financial aspect of the availability of these vaccines. Even they reviewed the TRIPS framework in the draft treaties to make it more flexible, so that if I can say that a lot of brain and a lot of heart has put into this draft treaty, I think it's a right statement. Heart, by saying that a lot of heart has put into draft treaty, means that equitable access and equity pricing, these are the two yardsticks which were defined and analyzed in detail in this treaty. But one aspect which I think is missing, and which should the international community should look into this, and Pakistan can play an important role in fostering this idea that despite all these international measures, draft measures, if a state or any company which is not complying with this international committee, what should be the mechanism for the enforcement? And this type of enforcement mechanism, which we usually see in other human rights treaties, is missing. So I think this aspect should be strengthened, and hopefully with these new efforts at international law, and then again, this treaty is being facilitated by WHO with the support of COVIX and their learning. So I think international law is mindful of these challenges and is trying to address. Hopefully with this treaty, some of the aspect of accessibility, availability will be addressed. I hope I answered the question. Thank you.
Thank you, Professor Mustafa. I think that was a very a good answer for this question. And I totally agree that, in international law, enforcement is always an issue, and it always collides with realistic geostrategics and considerations. We have time for one more question. If anybody has a question, please write in the chat box, or you can also speak out. One more question we have. Yeah. Okay. So with this, I'll request President IPRI, can you hear me? Yeah. So I'll request Dr. Raza Mohammed for delivering the concluding remarks and wrap up this webinar. I'll also speak a little about President IPRI. And so President IPRI has held various prestigious command and staff assignments in Pakistan Army, and he retired as a Major General in the Pakistan Army. After retirement, he was also appointed Ambassador of Pakistan to Mauritius and Madagascar. He has also served as advisor to President National Defense University, Islamabad, and he's now currently serving as the President of Islamabad Policy Research Institute. Dr. Raza Mohammed, can you please conclude this webinar and wrap up the discussion? Thank you very much.
Bismillahirrahmanirrahim. Thank you so much, Shahzeb. And first of all, I will take this opportunity to extend my gratitude on behalf of myself and on behalf of IPRI to our honorable speakers. Ma'am, Dr. Shazia is not, I think, no more on the here on the net, and then Ms. Maha Rahman and Ataul Mustafa. I think Dr. Rashid, Director Research, IPRI, gave a very good opening pitch, and then we had wonderful speakers talking on to us on various things. The good thing was that everyone spoke on the different aspects. No one repeated what was said before. So thank you so much, everyone. And it was a wonderful session. I just want to add one or two things here. First of all, I think Ms. Maha Rahman very aptly hinted at the point that Pakistan has been, despite the fact that we were not a developed country, we were not perhaps that much prepared for the pandemic, but Alhamdulillah, Pakistan has been a success story, and Pakistan is being perhaps emulated now and quoted also world over as one of the countries who handled this pandemic very effectively, very aptly, and very intelligently. Actually, we devised our own methods of controlling the pandemic, and we did not go for the full lockdowns as this was done in various countries or various places. These were the smart lockdowns. This was a kind of expression जो पाकिस्तान ने खुद इजाद किया, smart lockdown वाला. और सबसे बड़ी बात यह कि it was a whole of a nation approach. It was not only the government or the military or the institutions or bureaucracy or the ambassadors, but whole of a nation approach. The people cooperated, the institutions worked, the doctors worked day in and day out, risking their selves and their lives, and many of them lost their lives there also. And they, I would term them as shaheeds of this jihad against the pandemic. They lost many lives, and we experienced certain things. We experienced cooperation from certain countries, and we experienced less cooperation from certain countries, and we experienced blockade from certain countries also when it came to the provision of the vaccines and sharing of the knowledge was concerned. I think that is the point which touches very aptly a topic of today, that pandemics and the evolution of international order. When we talk of the international order, yes, pandemic and the vaccines were used as a tool of coercion, tool of diplomacy, and tool of international political economy as well. Now, you see, I think Maha gave a very good example of the Sputnik. Till today, one country is saved. I think Russia used Sputnik. Pakistan also had the Sputnik here. We used COVAX, we used Sputnik, then Pfizer, and then Moderna, and every vaccine was used here. And Pakistan benefited from all those vaccines. But in certain cases, as Maham Naveed very aptly asked, कुछ थी जिनके साथ आप ट्रैवल कर सकते थे, कुछ वैक्सीन लगा लें तो आपके ऊपर ट्रैवल का बैन था, क्योंकि वो वैक्सीन जो है एशिया से आई थी, वेस्ट से नहीं आई थी. सो ये जो पॉलिटिक्स है, इसने भी इंटरनेशनल पॉलिटिक्स ऑफ वैक्सीन, आई वुड से, ये इकोनॉमी के लिए भी थी, गेन्स, sorry to say, making money from the vaccines, and also for settling the geopolitical scores, जो कि international competition अभी जा रहा है. So idealism अपनी जगह पे, real politics अपनी जगह पे, but this COVID did play a role in the real politics and geopolitics also. With this, I thank you all again. And Shazib, very well conducted. I must appreciate. You conducted it very well and coordinated it very well. Once again, thank you, Maha. Thank you, Mr. Ataul Mustafa. Thank you, Dr. Rashid, Ambassador Durrani, I can see, and Mr. Shoaib, I can see, Noman Bacha. Yes, a very good question. And similarly, very good questions from Mavish and others who asked these questions. And I think the asking of the question did make it more interesting for everyone. Zishan did ask a question and so on. So thank you, everyone, once again. And it was lovely to have you. And it was so useful discussion. And it is an addition to the knowledge. Very grateful. God bless you all. Thank you. Shazib.
Thank you, Dr. Raza, for your kind remarks and very kind appreciation. With these remarks, we conclude our webinar, and we earnestly thank our panelists for their graceful presence, as well to the audience for their interest and questions. Thank you very much. With that, we can